Well, if you know someone who's been diagnosed with cancer, you know how hard that battle can be. Now, add to that the stress of a shortage of chemotherapy. We have learned more than 90% of U.S. cancer centers are having a shortage on chemo drugs.
Our 9 health expert, Dr. Kohli, joins us this morning. So first of all, Dr. Kohli, what is the reason behind this shortage?
You know, we had a shortage before, guys, but now it's become a really bad shortage. You know, with 93% missing carboplatin, which is one of the main agents, 70% missing cisplatin, and we think it's multifactorial. So manufacturing is probably the biggest reason. There have been some problems with manufacturing and getting the ingredients. But post-pandemic, we're also seeing a spike in the cases of cancer. So the number of prescriptions that we're writing for these agents means there's more demand as well.
Why is there a spike in cancer after the pandemic? People delayed getting their...
That's right. Yes, yes. So actually, if you look at the trends for cancer, there was a reduction in diagnoses during the pandemic, during the lockdown phases. That didn't mean people weren't getting cancer. That means they weren't getting diagnosed, especially early on. And now they were getting diagnosed with more late-stage cancers. And so you have to be more aggressive when the cancer is late-stage and actually pull out the big guns. And carboplatin, cisplatin are two of the kind of best chemotherapy agents that we have.
Wow. What is the impact of these shortages when it comes to cancer patients?
I mean, these are the agents that we use to try to cure people of their cancer, you know, and they're platinum-based agents, and they work in a variety of cancer: breast cancer, lung cancer, prostate, even the liquid cancers like leukemia and lymphoma. So you can imagine if we use them in 10 to 20% of cases, you know, 500,000 cancer patients a year that get them, and we don't have access to them, doctors have to have difficult conversations with patients and start prioritizing which patients are going to get life-saving chemo. So for example, if you have a cancer that's advanced, you may get put to the bottom of the list, even though you might have done better with this chemo agent because there's not an intent to cure. What a lot of other physicians are doing, some of my colleagues who are oncologists, is changing the order of chemo medications, giving them out of order in a way that they haven't been studied, you know, extending the time between cycles, again, something that's not really studied or recommended, but when you're in a shortage, you have to reach for everything. So it's just a really, really tremendous impact on our patients that are fighting cancer.
When you talk about having to prioritize patients, I hope that's something that pulls at everybody's heartstrings, because we all know someone, or maybe you are someone that has battled cancer before or are battling cancer. You would hope, though, for all the people that do rely on this drug, that the FDA or some other agency is doing something to address this shortage. Is that happening?
It is happening, but unfortunately we anticipate it's going to last for several months, this shortage. And so for now, the FDA has allowed foreign importation of these agents. Generally, we want U.S. manufactured chemotherapy agents so we can regulate them, but they're allowing them to come from China and from Canada, sort of as a stopgap arrangement until we can get more of a supply. But it's really raised a bigger problem, which is that now after the pandemic, we have to stop using this manufacturing shortages as an excuse. We really need to hold a lot of these drug companies accountable, because there's a moral, ethical, and scientific obligation to make sure not just this medicine, but all the other medicines we've talked about, Ozempic and others, they really step up the manufacture so that we can treat people with disease in a quick and efficient way and really, you know, heal from the collateral damage of what the pandemic has created.
That breaks my heart that some doctors are having to have these conversations or do things that really haven't been studied in hopes that it works, or just like hold them off for a couple months until this comes back up.
Yeah, and imagine if you're that patient where the doctor comes to you and says, we have a better medicine, but we have to give it to someone else because we have a shortage.
Yes.
And you're going to have to settle for second best. And I mean, this literally is life and death.
Tough situation. Dr. Kohli, thanks for coming in.